Hello, 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 everybody. Hello and happy Monday. As always, let me know if you can hear me in the chat, and then we will go ahead and begin our class. I just need one yes, and then we will go forward. All right. Thank you guys so much. Thank you so much. Thank you. So, yes, hello and welcome as always to another week of our wonderful ICD 10 CM Guideline Mastery session. I am Miss Haley. I'm going to be your lead instructor for this class. I'm so excited to welcome everyone, and I am also accompanied by my wonderful team as always, Miss Olga and Miss Vina. I'm sure you've seen them greeting everyone already in the chat, bringing that positive energy. I am super happy to have them on our Monday team, so shout outs to them. So we are beginning our week 7. I just feel like time is flying by so fast. We're already in week 7. So today we are going to be going over and reviewing our pregnancy complications, perinatal and congenital abnormality guidelines. And as always, I'm going to be using our ICD-10-CM guidelines. I'm going to be using the ICD-10-CM book, and I'm going to be referencing our MCG manual in this session. So make sure to have those both handy if you can. And we're going to stick to the same flow as we've been doing. So we'll warm up with our Jeopardy game, a little true or false, and then we'll do our Quizlet game to really test our coding guideline mastery skills. And then I'll go over the questions and the guideline references and all of that good jazz so we can use this video as a review tool in the future. So let's go ahead and let's just get right into it. I also see that we have some new people, so welcome, welcome. If you have any questions, definitely feel free to ask. Like I said, we have a wonderful team here tonight, and they are more than happy to help you answer those. And if you have any questions after the class, or if you have any questions you don't want to ask in the chat, we're going to post our survey link as always, and definitely make sure to fill that out if you have any questions, or just to give us some overall review for how we are doing on these classes so we can make them better for you and make sure you guys are learning as much as you possibly can during our 1 hour we have together. So we'll post that in the chat momentarily, and I will go ahead and get started with our copyright super quick. I will try to be quick with this. All right. So ICD-10-CM copyright 2026, American Medical Association, all rights reserved. Fee schedules, relative value units, conversion factors, and or related components are not assigned by the AMA, are not part of CPT or ICD-10, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained. ICD-10-CM is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FTR, CHUN, AMCI Fab 7, AMCI ICD-10, FLIP, TAP, and MCG are trademarks of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHEMA. AMCI does not own the rights to these credentials. Whew. So, with that being said, I will go ahead and get to the good stuff. We will go ahead and warm up. Thank you, Miss Olga, for posting that link in the chat. So definitely be sure to click on that. We'll post it a few more times throughout so you don't have to keep scrolling. All right. No, it was an hour last semester too, believe it or not. I know, the hour just flies by. I feel that way as well. But I'm glad it's flying by and it's not dragging on. All right, I'm going to stop sharing my screen really quick, and I'm going to grab our Jeopardy game. So for those of you that are new, this is just going to be a warm-up game where we do true or false scenarios, and I take clips directly from the MCG manual. So it's all going to be related to our pregnancy complications. All right. So here we are. This is how I'm splitting it up today. So I'm splitting it into 4 different categories. So we're going to do 2 chapter 15. So chapter 15, pregnancy, childbirth, and the puerperium. The next one is also going to be from chapter 15, pregnancy, childbirth, and the puerperium, just because there's so many guidelines that are a part of chapter 15. So I'm just making it 2 sections. And then we're going to move on to chapter 16, certain conditions originating in the perinatal period. And then lastly, we have our chapter 17, congenital malformations, deformations, and abnormalities. As always, just put your answers in the chat. You guys are awesome, and this is all going to be taken directly out of the MCG manual. So, oh, why is that font so small? That's strange. Okay, so we are going to start off. Let's start off with a 100 from chapter 15. Oh no, I keep cutting out. Let me see. All right. Hopefully that will fix it. I unmuted myself and muted myself. So hopefully clear now. Thank you so much. Okay. Sorry about that, everyone. Okay. Let's start with 100. All right. True or false? Chapter 15 codes, or O codes, are used exclusively on the maternal record and should never be assigned to the newborn's record. Is this going to be true or false? You guys got this one. Let's start off this game with a bang. Let me know in the chat. All right, amazing start, amazing start. Hello, is it going to click? Oh, I have to guess. All right, and it is indeed true. Yes, those O codes are exclusively on the maternal record. There is a different section for newborn records and all of those codes, so that definitely makes this one true. I think everyone got that one right, so great job. All right, let's do another one from chapter 15 since there are so many. Let's do a 200. Okay, so true or false, postpartum is defined as the 6-week period following delivery, while the peripartum begins in the last month of pregnancy and extends up to 5 months after delivery. What do we think, guys? True or false? Let me know. All right, I'm getting a little bit of mix, So let's see. True. So yes, postpartum, 6 weeks following delivery. Peripartum begins in the last month and extends up to 5 months after delivery. So if you got that one right, I know that was a little 50-50, but as always, I'm going to put the exact guideline where I found this snippet so we can look back and use that to get some extra study. And that's why we're all here. Practice makes perfect. I'm loving everyone putting those answers in the chat. Keep it up. All right, let's move on to a chapter 16. Are certain conditions originated in the perinatal period? Let's do a 300. All right. True or false? If a condition starts in the perinatal period and persists throughout the patient's life, continue using the perinatal code regardless of the patient's age. True or false? Let me know in the chat, coders. All righty. I'm getting a lot of trues. This one is indeed going to be true. I thought this one was a little crazy. Um, I was like, there's no way if a condition starts in the perinatal period, you're just going to use it throughout their life. But this one is true. So this is definitely one of the, I thought this is a pretty cool guideline. But yes, I think everyone got that one right. Great job indeed. All right, let's move on to chapter 17, congenital malformations, deformations, and abnormalities. Let's do a 100. Oop. Okay, true or false? Codes from chapter 17, which again are the ones that I just listed, the malformations and everything, may not be identified until later in life. Whenever it is diagnosed, it should be coded. So, what are we thinking? When are we coding these codes from chapter 17? All right, I'm getting so many responses on this one. There's so many answers coming in the chat. We love to see it. All right, so this one is going to be true. So yes, again, the chapter 17 is going to be the congenital malformations, all of that stuff. And so you're not going to use those codes until later in life. So whenever it's diagnosed, it should be coded. So that's what makes it true. Again, I will reference the exact guideline where it says this whenever we are finished with this game. So have no fear. You put your answer in the chat. Amazing job. Okay, let's move back to our chapter 15. Let's do a 300. Okay. True or false? For cesareans or cesarean section, sequence the condition that led to the cesarean as the secondary diagnosis. True or false? Let me know in the chat, coders. I'll give you guys a few seconds. Okay. I'm getting a lot of falses. This one is indeed going to be false. So, yes, in the MCG manual and in the ICD-10 book, it says for cesarean sections, sequence the condition that led to the cesarean as the principal diagnosis, not the secondary diagnosis. So, that is what makes this one false. And it seems like everyone caught that one. So, way to stay on top of it. Okay, let's do another 300 since you guys are killing it. And we're sticking with chapter 15 with the pregnancy, childbirth, and the preparium. Let's check it out. Oh, this is going to be a long one. All right, true or false? If a patient had a pregnancy complication earlier in their pregnancy, but that complication is completely resolved and not present when they come in to deliver, a normal delivery code cannot be used. Is this going to be true or false? If they had complications in the beginning, but no longer, are we going to code that normal delivery code? Yes or no? Let me know in the chat. Okay, I'm getting a little back and forth, a little 50-50 on this one. So this one is actually going to be false. So the reason this one is false is because, again, looking in our guideline book or our guideline section of our book, it says if a patient had a pregnancy complication earlier in their pregnancy, but that complication is completely resolved and not present when they come to deliver, a normal delivery code can still be used. And that's going to be our 080 code. So if it's completely resolved, a normal delivery code can still be used, but if it's not resolved, then that's a whole nother situation. If you caught that, great job. But again, I'm loving this participation. We are getting some good practice in, hopefully getting some aha moments. All right, let's move on back to chapter 16. Let's do a 100. Why is that showing up? Okay. True or false? Only assign a prematurity code if the provider has documented it. True or false? I will reference the exact one. I'm not sure off the top of my head, but I have it in the presentation that we're going to go over. So I'll definitely show it to you guys whenever we're done with this. All right. I'm getting an outstanding amount of trues, and I'm glad because indeed it is true. So, yes, of course, we never want to assume anything. So, we definitely want to only assign something if the provider has documented it, and that is going to include that prematurity code. So great job. All right, let's do a 300 from chapter 17. Let's take a look. Okay, this is a long one. Okay. True or false? Use codes from Q00 through Q99 for documented congenital malformations, deformations, or chromosomal abnormalities. These codes may be assigned as the principal diagnosis only. True or false? Alrighty, alrighty. There is a pretty even at this. This is going to be false. So the reason that it is false is that it says in the book that you use codes from Q00 through Q99 for documented congenital malformations, deformations, chromosomal abnormalities. That's true, but these codes may be assigned as principal diagnosis or a secondary. Oh no, my mic is cutting out. Okay, hopefully that fixes it. All right, so yes, these codes may be assigned as principal diagnosis or as a secondary diagnosis. It doesn't have to be principal diagnosis only, so that's what makes it false. So if you caught that one, great job. I was trying to be a little sneaky by just deleting one little snippet. So if you didn't get that one right, have no fear. All right, let's do our 200 from our chapter 15. Okay. True or false? Assign gestation codes based on only fully completed weeks. So if someone's 25 and a half weeks, are we rounding up to 26? What are we thinking, guys? Let me know. All right, all right. Are we basing these codes on fully completed weeks? Indeed, we are. We don't want to be rounding up, just in case. So we want to have the most accuracy that we possibly can. So, yes, we are only assigning codes based on only fully completed weeks. Indeed. Exactly. You wouldn't round up to the next week if they haven't completed it yet. 100%. I totally agree. All right. So, great job. I think everyone got that one right. Great work. All right, let's complete our other chapter 15, close it out. Okay, pregnancies in patients ages 15 and younger are considered young maternal age pregnancies, but are not classified as high risk. True or false? Okay, I'm getting some falses. This is indeed false. So it is true. So pregnancies in patients ages 15 and younger, they are considered young maternal age pregnancies, so that would be correct, but they are classified as high risk due to the potential health risks associated with young maternal age. So that is the reason that this one is false, because they would indeed be classified as high risk. So if you caught that one, which a lot of you did, amazing job. All right, you guys are killing it. I mean, you always do. I'm never shocked that you guys are killing these games for sure, but it's always nice to see. Okay, chapter 16. Let's close this one out. All right. True or false? The perinatal period for coding and reporting spans from before birth until the 60th day after birth. Specific guidelines apply to coding conditions and treatments during this time. So, is this true for the perinatal period? Are we thinking true or false? Let me know in the chat. All right, I'm getting a little bit of a mix results for this one. So this one is going to be false. So the reason that this one is false is because it says that the perinatal period for coding and reporting, so it does span from before birth, but it doesn't span until the 60th day after. It is before birth until the 28th day after the birth. So the reason that this one is false is because that period is incorrect. So it's from before birth till the 28th, not the 60th day. So that's what makes this false. So if you caught that one, great job. Alrighty. And then let's close it out with this 200 from our chapter 17. Okay. True or false? Use personal history code or codes if the condition has been corrected and is no longer being treated. True or false? Let me know in the chat. Let's end this game on a great note because you guys have been killing it this whole time. And then we will move on to our Quizlet scenarios. Alrighty. Amazing, amazing. So this one is going to be true. This one is indeed true. So yes, we are using that personal history code if the condition has been corrected and is no longer being treated. So absolutely outstanding. Okay, I'm going to stop sharing my screen really quick and go back to our PowerPoint. Okay, and then I did say we're going to do the Quizlet game, and we are, but I'm going to go through quickly our guidelines that were used during this one. I specifically took them from the MCG manual, so it can be found in the ICD-10 book as well, but the specific numbers and titles that I'm referencing are in the MCG manual. So if they don't line up completely with ICD-10, that's why. But I will share these with you. So first, we are going to start off with, of course, our first column. So our chapter 15, our pregnancy, childbirth, and the preparium. So these are, of course, going to be all of the questions that I asked, and then all of the answers, and then all of these specific guidelines that I used for these ones. So again, this is going to be a recorded video. So I'm going to kind of go through these a little fast because we just did them. So if you want to go back over them, you can pause and take a look and go through them as at your own pace. So this is the first column, our trues and our falses. This is going to be our second column. Notice here, this wasn't a specific guideline. So with the pregnancy and the patient's ages 15 or younger, this is just kind of like a, Mrs. J gem that was inputted in the MCG manual. So this one you specifically won't find in the ICD-10 guideline book. This one's specifically in the MCG manual. So if you weren't able to find it, that's why. But all the other ones, you would be able to locate them in both books. So again, these are the questions, these are the answers, the specific guideline. Chapter 16, certain conditions originating in the perinatal period. Questions, answers, guidelines. And then last but not least, this is going to be our chapter 17, our congenital malformations, deformations, and abnormalities. So hopefully posting these, that if we needed some clarity, that it will be provided with this. And then and if you have any further questions, like I said, you can always click on the survey link, and that also doubles as if you have any questions, I will take a look at them tomorrow. So if you need any further explanations on those guidelines, just let me know. I will be more than happy to go over them with you. And now we are going to move on to our Quizlet scenarios. So I'm going to stop sharing my screen once more, and I'm going to switch over to our Quizlet. For those of you that are new, our Quizlet scenarios, we break down a scenario into 3 different parts. We break them down into our keywords, our guideline that we're going to use to solve it, and then finally our final ICD-10 codes so that we can fully understand what we're doing when we're looking at a scenario. So I will move to this. And again, you're just going to be putting those answers in the, oh no, don't look. It always starts like in the middle. That's so strange. Okay, so this is going to be our first scenario. So we are taking out the keywords from it. So Mrs. Bloom, a pregnant woman at 26 weeks gestation, presents with gestational diabetes controlled with diet and insulin. So what keywords are we taking out of this scenario to go to our guidelines, to go to our codes? Let me know in the chat. I'll give you guys a few seconds for that one. All right, if you're still typing, that's totally fine. Still put those answers in. But yes, what I'm focusing on are going to be, as everyone said in the chat, our 26 weeks gestation. our gestational diabetes, and the diabetes is being controlled with diet and insulin. So if you put that in the chat, which everyone put some form of that in the chat, so great job. Now we are going to be using our same scenario, and now we are going to be focusing on the specific guideline that we're going to be using to solve this one. I will give you a hint. It is in chapter 15, just to kind of narrow that down. Let me know in the chat. You can either put the number or you can put the title if you want to. However you want to do it. Just let me know in the chat and then we will move on. We are looking for the ICD-10-CM, the guideline that's going to be reported. So what guideline do you think we're going to be using to solve, to look for our official ICD-10 codes? What guideline are we going to be using? All right. And I'm getting a lot of awesome responses in the chat. So yes, the guideline we're going to be using is our IC15I, which is going to be our gestational or pregnancy-induced diabetes. Great job. Great catch, everyone. And now, without further ado, we are going to be using those keywords. We're going to be using that guideline, and we are going to be picking out those ICD-10-CM codes or code. What are we going to be using to code this scenario, guys? Let me know in the chat, and then I'll move over to our presentation, and we can all go through it together. Okay, if you are still solving this, I'm not going to put the answer in the chat just yet. I'm simply going to switch over. What am I doing? I'm simply going to switch over to our PowerPoint so we can see how everything looks all together. Okay. Let's see. Alrighty. So again, this is our scenario, and the guidelines we're taking out of this are her 26 weeks of gestation, that gestational diabetes, and the gestational diabetes being controlled with diet and insulin. This is what the guideline looks like. I think it's okay, yes. So this is the whole guideline. So our IC15I, which is going to be our gestational or our pregnancy-induced diabetes. So automatically, if you look right here, to the right, it's giving us a sequencing suggestion. So our first is going to be our 024.4 code, which is the gestational diabetes. So we're going to be using different codes if the gestational diabetes uses insulin or is controlled by diet. So that's why we were pointing out that those keywords controlled with diet and insulin. So that's what's going to lead us to our first code. So our first code is we're going to go to 024.41. Gestational diabetes, mellitus, and pregnancy, but we are going to go down right here to do 024.414 because if you look again right here on the right hand side, it says that if the gestational diabetes is being controlled with diet and insulin, you are going to code only for the insulin. And it shows right here, the code is going to be 024.414. So that's why we're going to be using that instead of the 024.4. Just because, again, keywords are super, super important. So that is going to be our first code. And then if you go back, our second coding sequence, we obviously have to put our weeks of gestation. That is very important when we're using, someone that's pregnant. So it's going to be a category from Z3A. So we look back at our keywords, we see that she is 26 weeks gestation, and that leads us to select our second code, which is going to be Z3A.26, which is going to be our 26 weeks gestation of pregnancy. So those are going to be our two codes that we're going to be using to report for this scenario. So if you got that one right, if you were on the right track, or hopefully if you didn't, if the explanation made sense, hopefully we had some aha moments, but definitely do not forget when you are dealing with a scenario that has a pregnancy, definitely do not forget to code for those weeks of gestation. It's very important. So if you are on the right track, amazing. Yes, well done indeed. All right, we still have two more, so there's plenty of chances. I'm going to stop sharing my screen and switch back to our Quizlet so that we can go on to our next scenario. That was some amazing participation, guys. Keep it up. Okay, and then we are going to start from the beginning and we are going to take our keywords out of the scenario. So the scenario is going to be newborn twin girls were delivered in the hospital via cesarean section at 27 weeks, weighing 850 grams for twin A and 900 grams for twin B. Both were diagnosed with extreme immaturity. So what keywords are we taking out of this scenario? Let me know in the chat, coders. All right, amazing job. You guys type so fast. I know I say it every week, but it's just always impressive. So, indeed, yes, there are a lot of keywords to take out of this scenario. So we have our twin girls, we have the delivery of cesarean section, specifically at the hospital. We have the weights, which is 850 grams and 900 grams, 27 weeks, and then that extreme maturity. So everyone put something like that to that effect in the chat. So great job. And now we are going to move on. We are going to move on to our guideline. So again, using those keywords, and then the guideline is going to be from chapter 16, just to kind of narrow it down, because I know there's like a billion guidelines with this. So yes, it's going to be in chapter 16. Let me know what we think in the chat. All right. I'm getting some responses in the chat. So, yes, we are going to be using guideline IC16A2. So, this one was a little difficult. So, this is just general perinatal rules, principal diagnosis for birth record. So, yes, that one was a little difficult, but if you got that one right or if you were on the track, great job. There are also, I'm sure, other guidelines that you could use from chapter 16 as well to help code this one. All right, and with that being said, now we are going to move to our guidelines. Oh my gosh. We're going to move to our ICD 10 CM codes for both of the twins. So, how are we going to code this? And then I will move on to our PowerPoint. All right. Still continue working. I'm just going to switch over to the PowerPoint just so we can go through it together. Okay. All right. So this is our scenario. And again, the keywords we're taking out of this are the twin girls, delivered via cesarean section in the hospital, the weight of the twins, the 27 weeks of the 27 weeks, and then the extreme maturity, or the extreme immaturity is what that should be. So this is a guideline that we're going to be using. So from chapter 16, the IC16A2. So the guideline right here, it indicates that when coding the birth episodes in a newborn record, you're going to assign a code from category Z38 the live born infants. So according to place of birth and type of delivery as the principal diagnosis. So a code from this series is assigned only once to a newborn at the time of birth. So obviously, if you go into your ICD-10 alphabetic index, you're going to look up newborn, twin, born in hospital. So again, that's why we chose to have that in the hospital taken out for the keywords, and then by cesarean. So going through that sequence, it directs you first to use code Z38.3. So this is going to be the code for twin live born infant, specifically born in the hospital. And then you have to go down because this needs 5 characters. So you go down to twin live-born infant delivered by cesarean, again, using the keywords that we took out of that scenario. So that is going to be our first, and then we also have to take into consideration the weight. So after this, we are going to look up low birth weight, extreme, and so there is a code after this right here. So this is going to be P07.03. So this codes for the extremely low birth weight for a newborn, and it's going to be 750 through 999 grams. So this takes both of the 850 grams and 900 grams. It would account for them. And then lastly, we have our extreme immaturity of a newborn, because extreme immaturity was, again, another keyword that we took out of there. So extreme immaturity of a newborn, specifically gestational age 27 completed weeks. So that is why we chose that code, and that lines up with the low birth weight, and then prioritizing the live-born infant born in the hospital through the cesarean. I cannot say that for a second. So all these codes take into account all of the keywords we took out, and so this is how you would code this scenario. I see a lot of people taking jabs at it, and we are on the right track. Does this explanation make sense? Do we understand why the codes were used for this specific scenario? Let me know in the chat. That one was a hard one. It was. That one was a little difficult. I know. I was really testing the waters there. That one was a little difficult. But again, if you can go through and pick out the keywords, if you can choose a guideline and you can take those specific codes out without even having to look at the multiple choice, then that is when you know that you really understand what is going on with the scenario and how really to use all of your different skills into really mastering the guidelines and mastering this coding. So hopefully we had some aha moments. I definitely agree it was a little bit difficult, so if that's how you're feeling, that is totally valid, but hopefully the explanation made sense and the participation is amazing. So we are now going to move on to our last scenario for the night. I will go back to our Quizlet. All right. And we will go to our scenario, and we will go back to our keywords. Okay. So here is our last scenario. So a patient has a spontaneous complete abortion 3 days ago. She returns to the ED and is bleeding. After ED provider examines her, she still has retained products of conception, or POC. So what keywords are we reporting for this encounter? Let me know in the chat. This one won't be as difficult as the last one, so don't worry. Let me know in the chat what the keywords are going to be. Okay, amazing responses in the chat. Amazing. This is a great start. So yes, we are taking out the spontaneous complete abortion 3 days ago, specifically returning to the emergency department for bleeding, and then of course that POC. So everyone got that one, or put something like that in the chat. Great job. Now you know what we're doing. We are going to our guideline selection. So what guideline are we reporting, or what guideline are we using to code this encounter? We are going back to chapter 15. So the guideline is going to be from chapter 15 that we're using. Let me know what you think in the chat, and then we will go over it in a sec. Okay, so yes, indeed. Again, like I said, it's going to be from chapter 15. So it's going to be IC15Q2. And the title of that guideline is going to be Termination of Pregnancy and Spontaneous Abortions, specifically retained products of conception following an abortion. So that is going to be the guideline we're going to be using. And then last but not least, we are going to now select our codes. So what ICD-10-CM code or codes are we reporting for this encounter? I'll give you guys a few seconds, and then we'll switch over one last time to our presentation, and we will go through it together. Okay, I'm going to switch over to our PowerPoint, and then we will go over everything. Alrighty. So again, keywords we are taking out of our scenario are going to be the spontaneous complete abortion 3 days ago, returning to the ED for bleeding, and the POC. And this is what okay. Well, this is going to be the code. So this is going to be the guideline for that we're going to be using. So the IC15Q2. So it says in here specifically, it says that when a patient has retained products of conception following a spontaneous abortion, report a code from category O03, spontaneous abortion, even when the patient has been discharged with a diagnosis of complete abortion previously. So that definitely applies 100% to this scenario, because in the beginning it says that there was a complete abortion 3 days ago, and then she's returning because she has that POC, the products of conception. So even though the complete was reported, we're still going to use that category O03 for the spontaneous abortion because she is returning for the POC. So with that being said, we go to that category, that O03.1, and because she is reporting bleeding, which is going to be Another keyword we're going to be taking out because she's returning for bleeding, we're going to use our code delayed or excessive hemorrhaging following incomplete spontaneous abortion. So you really have to focus on this guideline and really read it through to be directed to what specific category and what specific code then you're going to use. But all of this, if you read it all, it definitely will guide you to the right code for sure. So, and that's why the keywords are super important as well. So does that explanation make sense? I know it says, so yes, it says complete, but then it says that she returns and then the provider examines her and she still has those retained products. So again, if you look right here, it says 4 follow-up encounters due to retained products of conception after spontaneous abortion. You're going to use the different codes incomplete. So you're going to use still the incomplete, even if it was previously, because she's coming back because she still has those retained products. So that is why it was incomplete. So hopefully that makes sense. Everyone was definitely on the right track when it came to that one. So great job. And as always, if you do, because I know that there were a lot of difficult scenarios that we went over. I know that I said last week that I definitely was going to try to amp up the difficulty. So I definitely did a little bit more difficult scenarios than we usually do, especially because some people wanted to get really into depth with those pregnancy scenarios and pregnancy guidelines. So if you do have any clarification questions about anything that we went over, any of the scenarios that we went over, again, we will post the survey link. So definitely make sure to click on that and you can ask any question if you need any clarification on anything. And I will definitely make sure to reach out so we can go through it so you can definitely understand all of those scenarios so we can make sure we are mastering those guidelines. So let us know how we're doing. Thank you guys so much. I know that was a lot. Thank you guys so much for joining me on this Monday. I cannot believe we are already going to be in week 8 next week. Time is flying by. So yes, we are going to be here next week, Monday, 7 p.m. Eastern Standard Time. Shout out to Miss Vina and Miss Olga for being so awesome and encouraging in the chat. Definitely couldn't do without them and could not do this class without you guys. So thank you guys so much. Amazing participation as always. And I hope that everyone has a wonderful rest of their Monday. And thank you guys so much for joining.
4,000 exam passers and free classes at AMCI. Learn to coach straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI. AMCI.